Welcome to today's webinar, Supporting an Improved Patient Experience in a Post-COVID Shift to Virtual Care, presented by Alex Lennox-Miller, Senior Analyst at Chilmark Research, and moderated by Midori Uehara, Co-founder and Head of Commercial Sales Strategy and Provider Partnerships at OODA Health. Today, you're in for a real treat, as this will, in a large part, be a conversation between Alex and Midori around the Chilmark Research and ongoing analysis. In this webinar, Alex and Midori will be looking closely at the patient experience, the shift to virtual care, the working relationships between payers and providers, and finally, they'll consider the healthcare implications of improvements in consumer experiences by companies like Amazon that are making a concerted and potentially disruptive investment to deliver better healthcare. You're seeing the agenda slide today. In just a few moments, we'll do introductions, and then I'll pass the time over to Midori. Today's webinar is being recorded, and within 48 hours, we'll send out a link to an on-demand recording, transcripts, and the slides. We'll also be taking questions at the end of today's presentation. You can submit your questions throughout using the questions panel at the bottom of your Zoom controls. You can also upvote questions that you like, and you can comment on other people's questions. So please use those tools to engage throughout the webinar. To keep today's presentation lively and engaging, we'll also want your feedback. We'll be asking 2 live polls throughout, and then we'll have a survey at the very end. So without further ado, Midori, if you could advance the next slide, let's begin with introductions, and let me introduce our 2 presenters today. Midori leads the commercial sales strategy and provider partnerships at OODA Health. Previous experience includes Castlight Health, Bain & Company, strategy consulting. Midori holds an MBA and MPP from Harvard University and graduated Phi Beta Kappa with a BA in human biology from Stanford University. Alex Lennox-Miller is a senior analyst at Chilmark Research. Alex specializes in provider-payer-patient convergence. Before joining Chilmark, Alex was the senior business analyst for process improvement operations in Leahy Health System. He holds an MBA from the DeMoore McKim School at Northeastern University. And it's my pleasure to introduce both of these speakers today. And Midori, I'll turn the time over to you. Thank you.
Thank you so much, Chris. And I'm really excited to be here with you all today and to be chatting with Alex to share some interesting and exciting research. Briefly, just to set the stage a little bit, as Chris mentioned, I'm one of the co-founders of OODA Health. It's not yet a household name, although we are on our way. OODA is a healthcare technology startup. We were founded about 3.5 years ago. We are a venture-backed company, and we are really proud to have a fantastic roster of partners across both providers and payers. The focus is not on OODA today, though. It's about the consumer experience, which is something that we are very passionate about. But I want to dive into Chilmark and have Alex introduce Chilmark Research.
Thank you so much, Midori. Thank you for everybody joining us today. Chilmark Research is a research analysis and consulting firm based out of Boston, Massachusetts. We focus specifically on healthcare IT in all of its various forms. Specifically, today we're going to be talking about the consumer experience and the patient experience, but we have reports running the gamut from back-end infrastructure all the way up to patient-facing virtual care and everything in between. Our goal really is objectivity. It is precision, and it's to be forward-looking. We always want to be looking at what's coming up rather than just focusing on what's been happening or what has happened previously. Last year and this coming year, my research has focused pretty broadly, I think most people would say. A report on revenue integrity last year, virtual care report coming up, and then a couple of others later in the year. But I think you can say that there is a theme running through all of this, that when you look at the research, and certainly what I've seen as I've talked to vendors, as I've talked to providers, as I've talked to patients and payers and stakeholders on all different sides of the healthcare continuum, there really is an issue in healthcare of fragmentation, of inconsistencies in how solutions are used, how they're leveraged, who gets value from them, and how. And I think that's really going to be the focus of one of the things we talk about today, Midori.
Terrific. Thank you, Alex. And, to set the vision, and it is nice to start with where we want to go. What is our aspiration as an industry? We know that we have a long way to go when it comes to consumer experience in healthcare, but where do we want to head and how do we get there? So just to set that stage, we at OODA, and I know Chilmark has been writing about this too, imagine a world where payers and providers are not just clinically aligned, but also administratively aligned. We've seen the convergence of, payviders enable clinical alignment. We've seen value-based care start to create incentives for clinical alignment, but administration lags behind. And as you mentioned, Alex, just now, fragmentation remains a persistent problem in the industry and gets in the way of a real consumer experience with implications for clinical quality. Another aspiration and where we want to go is a world where consumers actually trust the administrative and financial processes associated with their care. I can't tell you how many times I talk to friends, family, or other folks in the healthcare industry who say, I get these communications in the mail about healthcare bills, about my coverage, about what I owe. I can't make heads or tails of them, and they seem to conflict. I don't trust what is being told to me. And that's a major barrier to streamlining if we, at a fundamental level, haven't established trust with our consumers. And then third, and I think this is your recent research, and the acceleration of virtual care has forced this to the fore, which is, what if we lived in a world where people are receiving care in their preferred appropriate setting? No longer are they going to the clinic if the call could have been done via a virtual visit. And how do we wrap seamless digital tools around that distributed clinical experience? That's where we want to head. And so today, I'm really eager to talk with you about where we can go, how we get there when we put patients first in service of this vision. So I'm going to start out and give some market context, and then Alex is going to present some of his research, and we'll have a dialogue throughout. And as Chris said in the beginning, please share your questions as they come up. We'll do our best to both answer in real time, and then if it makes sense to save toward the end, we'll allocate some time toward the bottom of the hour to address your questions specifically. But I want to talk through some challenges that predate the pandemic that we've all been living through over the last year, which has certainly turned things upside down, but in some ways it's also just accelerated trends or exacerbated weaknesses in our industry that were there before. And so just a summary of some of these challenges and our opportunities. First, patient experience is fragmented, even within an episode of care. A patient goes to the hospital, receives what feels like one cohesive clinical experience within the hospital, but then they get a bunch of bills from affiliated providers, or perhaps the facility and professional bill separately. This is made even worse when we layer in the new modes of care that patients are seeking, whether it's virtual, if they're having a virtual visit with their provider, or perhaps it's one of these virtual first providers. That information doesn't talk to what they're experiencing within a hospital setting, for example, or the retail setting, Minute Clinic, Walgreens, care providers, that's exploding. And so how do we make sure their right information is getting transferred across all of those settings? Second is around expectation. And we know that consumer expectation and reality are very far apart in healthcare, but we've benefited from digital first experiences in pretty much all other parts of our lives. That's raised the bar for healthcare, and we haven't been able to keep up. And then third, we'd be remiss if we didn't acknowledge system level factors that are holding providers back from delivering on the ideal consumer experience. There's legacy payer provider friction, antagonism, misaligned incentives, and then continued incentives from a profitability standpoint and financial standpoint for providers to focus on the acute care setting. So all of this is kind of creating a perfect storm. And then COVID hits. We have a dramatic acceleration of virtual care adoption, and we see a lot of opportunities to improve. And then I'd like to double click on some of these challenges, which we just were talking through. This is a note on payer provider friction and the dynamic that is underlying the explosion in administrative growth and complexity. So on the left-hand side, we find ourselves trapped in a vicious cycle where payers are investing in payment integrity to make sure that they're only paying for appropriate services. On the other hand, providers are investing in revenue cycle management and optimization, making sure that they're paid appropriately for all the services that they provide. And it creates this arms race where both sides is escalating in services and enlisting the help of other services to optimize their part of the equation. And what it leads to is exponential growth in administrative overhead. This is a tax that we all pay in our system. Another dynamic, Alex, that'll be interesting for you to speak to is the fact that patients are the new payer. We've seen steady and steep rises in both the adoption of high deductible health plan enrollment and the size of the average annual deductible. I don't think this is news to anyone that's been paying attention to healthcare or who has health insurance themselves. Pretty sure my deductible is at least $4,000 or $5,000, and that means that patients are interacting with the healthcare system in different ways. And then last, before I hand back over to you, Alex, this administrative overhead, the fact that patients are responsible for an increasing amount of their healthcare means that patients have to navigate complex billing processes and that providers and payers have to accommodate them and support them. Some research that we've done at OODA that we found that EOBs, which are theoretically supposed to match exactly with the patient bill, don't match about a third of the time. There's strong evidence that patients simply do not understand their medical bills, about 60%. And the most frequent reason for that is that they can't make sense of their benefits, which then feed into their bills. And then, we're in a digital world, and yet 80% of healthcare bills are still delivered via snail mail. And many providers don't have the capability to do it any other way. So that's some of the context, the market dynamics, even outside of COVID. So I will hand over to you, Alex, to tell us more about consumer experience, and especially in a COVID and post-COVID world.
Thank you so much, Midori. That's a really great overview of a lot of the challenges that we're going to be talking about. I think if there's one thing I want to make sure that people are focusing on as we move through this, it's first of all that issue of systems that are no longer meeting the needs of not just the patients, but the providers and everybody else involved in that healthcare environment, that haven't kept up with the pace of innovation and change and expectation, and that there are really key elements to the healthcare experience, like trust, the trust between a patient and their provider, or a patient and a health system, that are really essential to best clinical outcomes and that are actively inhibited by having systems that don't adequately support them. So as we talk about some of these issues, fragmentation is going to be a major theme. So if we can move to the next slide, what we've seen is that the consumer experience really has grown beyond what I think most people have historically considered. When we've talked about patient experience, when we've talked about provider experience, those have usually been pretty limited in scope. Usually it's pre-appointment and post-appointment. It is, the scheduling process, phone manner, follow-up. those have been very important. It's great that people have focused on them, but especially as we move into an era where more and more care is distributed virtually, where more and more care is done in the home and in different locations, all of a sudden that consumer experience touches all kinds of parts of not just the clinical encounter, but the entire experience of care. If you go to the next slide, we'll start digging into some of these. And what we'll see is that this is an incredibly broad section of activities. There's a ton of stuff here. It covers things that I think most providers don't even consider part of their workflow or part of their business. But when these activities are fragmented, when they aren't consistent, when they aren't being done in a reliable or a unified way, it makes it so much harder. And now that we're asking patients to engage in not just their own specific patient role in healthcare, but to take a much more active role in healthcare, to be involved not just in surveys and satisfaction reviews, but to be providing health information, to be responding to PRO questions, to be proactively involved in alerting their providers or discussing potentially issues that come up with their treatment or their medication. We're asking them to shoulder a lot more responsibility. And if the tools that we are giving them to access that aren't convenient, aren't useful, aren't consistent, patients simply aren't going to engage.
Mm-hmm.
As you look at this list, I think most people will look at this. Ask yourself, how many different workflows, how many different software solutions, how many different applications do you have doing all of these different tasks? How many different ways do patients have to interact with them? How many different ways do they have to learn to pay a bill, to schedule an appointment, just to access a telehealth appointment? How many steps do they have to go through? How many steps do your providers have to go through? Is the interaction consistent? Is the UI and the UX consistent across all of these different modes of interaction? I think most people will say there's no consistency. We've got a bunch of different things, a bunch of different solutions, and we're all addressing them. We're coming at them in very different ways.
And I totally agree that is the right question to ask ourselves. What does this look like today? And I'll add in, and this is also in response to a terrific early question we have, which is, our focus today is on providers, but mind you, payers are also doing some of this work too, and are trying to enhance their consumer experience by providing transparency tools, doing care gap outreach. And so, we have providers who are have a myriad of solutions for many of these components. Then we have payers, and it's even more fragmented than might first meet the eye. And what, OODA works with both payers and providers to try to foster some of that coordination and collaboration, because any one party really isn't equipped to fully manage it on their own. It requires that coordination that you're describing.
Yeah, this is a fantastic question. It's something we're going to be discussing, I think, more in depth later on. But, the fact of the matter is patients are accessing care from more areas than they ever have before. It's not just from their PCP. It's not just from the hospital. It's from their PCP, from a retail clinic near their house, from their pharmacy, from potentially consumer apps that they've downloaded, from a wearable, from their employer. All of these different stakeholders now need to be involved. And especially as you're talking about a consumer experience of healthcare, it's no longer enough for each of those things to be good enough on their own. So why does it matter?
Yeah, I was going to say, it feels intuitive that consumer experience should be better. We know it's not good today, but why hasn't it improved, and why should we care to begin with?
Well, the first reason to care is that it really does have a significant impact, not just on revenue, not just on the VBC metrics directly related to it. It has a really significant impact on all of the different sectors. And if you're familiar with the IHI quadruple aim, I'm thrilled. If you're not, it's worth reading up on. But fundamentally, these are the 4 goals of healthcare. And what we find is that consumer experience is vitally intertwined in all of them. It helps reduce cost, it helps improve experience, but it also improves clinical outcomes by building trust, by building that faith in reliability, by making things easier to access and easier to do. These are all components that touch every part of what our goal as a healthcare organization ought to be. If you go to the next slide.
You know, I'd actually love to pause for a moment, Alex, and,
Sure.
and dig in, because, you know, this seems intuitive. Do you have any hypotheses on why providers, you know, focusing on providers for now, haven't embraced consumer experience as a need to have, not just for marketing purposes, but as part of their clinical strategy and quality?
I don't think it's necessarily that they haven't embraced it so much as that the demands on providers have been so intense that the growth in demand, shrinking appointment times, larger panels, all move us away from that goal. And it's really only been relatively recently that we've started to see an explosion of tools to assist with that. It's not enough to just churn out appointments as quickly as possible and get as many patients in the door as we can. And unfortunately, that has been what, you know, you mentioned this earlier, that has been what the incentives have been pushing towards. That's where all the incentives have been. Providers are immensely concerned about the experience of their patient, but they have to operate within the environment that we give them as an industry. I think the other side of it is that historically, we have told providers to focus on the clinical side of healthcare. We have then burdened them with immense amounts of paperwork, of other tasks, of things to take up their time. And we haven't given them the opportunity to spend their time engaging with patients, looking up what's going on with them, talking to them. Those are all things that unfortunately make the patient experience, the consumer experience worse, but it's just the environment that they have to exist within. I don't think providers don't understand why experience is important. I think the industry as a whole and the incentives driving it simply haven't supported it before.
Yeah. So you're saying, you know, primary driver is lack of incentive, financial incentive to invest in it. And secondary is a question of relative prioritization. So
exactly.
Do you think that a shift to value-based care is required to create the incentives to deliver a consumer experience, or are there other dynamics at play in a fee-for-service environment that bump consumer experience up in the priority level?
I think value-based care helps a lot because it shifts that incentive towards engaging with the patient, having the patient invested in their own health and doing the things needed to support the patient outside of the clinical context. And as we start talking more about virtual care solutions, that's a big part of it. But you can do that outside of virtual care, and a lot of providers do. I think the other thing that has really shifted is that now we have tools and technology capable of supporting providers doing a lot of the heavy lift that's needed for providers to really engage in this activity. When you're talking, for example, about supporting a diabetic patient, a provider who wanted to give that patient really good hands-on support when they needed it would have to be keeping constant tabs on them, would have to be spending a huge amount of their time and their uncompensated time, because this is not a billable appointment, keeping track of that patient, talking to them, bringing them in. It's inconvenient for the patient, it's difficult for the provider. When you have technology that can do a lot of that inconvenient heavy lifting and just let the provider know whether or not the patient is doing well, whether or not their A1C is in control, and when it's not, alert them and give them the tools to then contact the patient, discuss with them, interact with them. That's a much easier lift for the provider. It's much more convenient for the patient. And it's something that was probably impossible, before 5 or 10 years ago.
Yeah. And I'll add one comment, and also Krista gave this question, so I'll add a note. Some of the tools you're talking about are around population health and clinical care engagement. We are seeing, because one dynamic I think that is also creating a new or updated incentive for providers to invest in an end-to-end patient experience is the fact that patients are the new payer. They own more. They're more engaged in their care because they have to be. And so, especially from a financial standpoint. And so there is a real financial incentives for providers to improve how they're communicating the financial responsibilities to their patients, and best practice to bring in all of the benefits context that is required for a patient to really understand what they owe, but also what is my care within my insurance plan, my budget, etc. So I think that's another hook that is somewhat new, both for provider incentives and for patients to engage in any way.
And when you're asking patients to shoulder more of that cost, when you're asking them to carry more of that burden, they want to know that it's worth it, that the care they're getting is worth those costs. They want to be able to make those informed decisions. That's why the payment process, the estimation process, all of those things, going as deep into things like referrals and prior authorization, which can really be a surprise to people if they don't know what the status of that is or how the management of that is going. If you're asking patients to shoulder those costs, they need to be informed about that. They need to be involved in those loops. And that's all part of that fragmentation of services and fragmentation of communication, which is causing so many of those consumer experience barriers. If a patient doesn't know how much something is going to cost, it's going to be much harder to bring them in and have them address something.
Right. So I know we've got a couple more important slides to get through, so I will keep us moving.
All right. As I said, it's no longer the case that consumer experience only addresses areas that are, on your MIPS survey or on your Press Ganey directly attached to your VBC metrics. If you're not familiar with Net Promoter Score, this is a pretty good general loyalty measurement. Measures how strongly your customers, your consumers, your patients think about you, how likely they are to recommend you, to keep coming back to you. We see that access, that shared services, that the ability to conveniently and easily take care of non-clinical things has a really significant impact on Net Promoter Score. But interestingly, what we also see is that Net Promoter Score is associated with these really significant care metrics, with improved outcomes. And, obviously I want to, be really clear. This is correlation. I can't say that this is causal. There are a lot of factors that play into this. The culture of the organization, quality of care, all of those things also play into it. But it is the case that this correlates very well with a lot of the other data that we have about how trust improves outcomes, how ease of use improves outcomes. And so as you start to build this more consolidated, more consistent experience for your patients, it's not just the case that they like you more, they're also going to be healthier. They do better.
Yeah. And this makes me think of, some other research and studies that we have seen where related to NPS and what the outcome is around patient behavior. Patients are making decisions based on their satisfaction, on where they receive care, on whether they're willing to return to a provider. And so I think it's a really useful leading indicator for how your health system is doing around a host of other metrics and associated with those efforts.
When patients feel that sense of ownership, when they feel that sense of involvement and inclusion, all of those things contribute to these outcomes. And those are the things that NPS measures really well.
All right. So go ahead.
No, I think we were going to say the same thing. So now that we've talked about, sort of what all of this means and why it matters, I think it's good to talk about what some of the things coming up in virtual care mean, what some of the upcoming trends are going to be, and how providers and other healthcare stakeholders can really start addressing them. Probably the most important one is this ongoing shift of the location of care. For a couple of years now, we've seen care really move from the inpatient setting in hospitals into outpatient and ambulatory settings. That was starting before COVID. It has accelerated really significantly. And now we are seeing really aggressive action from CMS and from the federal government to shift that even more. That is those changes to the inpatient service list, to what ambulatory surgical centers are allowed to do, current pilots being run for hospital at home. All of those are part of this shift towards a remote virtual experience. One of the unpredictable things, and one of the things that I think never could have been predicted before the pandemic, was how it has impacted people's willingness to engage in care and where they're willing to go to get it. One of the biggest focuses of a lot of providers now is, how do we bring patients back? How do we get patients who have deferred care, who have postponed care, to come back and start getting it? And unfortunately, what we see is that a lot of patients don't want to. They don't feel comfortable. If we can provide that, if we can do that in an outpatient setting or a home setting, that's something that they feel much more comfortable with. They're much more likely to do. And the more that we get those patients engaged again in the healthcare system, the better the outcomes are going to be.
Yeah. And so I think that, you were just speaking to this chart in the bottom right, which is responses to the question, are you comfortable returning to this setting? Could you speak to this chart on the upper right-hand side and just explain what we're looking at?
Sure. Well, what we're seeing is, like I said, that ongoing shift, that reduction in the number of patients who are being admitted and being discharged from a hospital of all different sizes. This is not something just happening in community hospitals. It's not something that's just impacting, large academic medical centers. This is happening almost universally across the board, and the impact is really significant. When you see these drops in volume, those correspond to really significant drops in revenue. And for a lot of health systems that were relying on, for example, elective surgeries and hospital revenues to really support their other functional areas, this is a really significant problem. Now we're seeing more and more health systems actually divest themselves of hospitals, really move to focus more in the ambulatory space. In some cases, it's leading to community hospitals closing and to care deserts expanding. All of that creates a sort of feedback loop, encouraging more of this virtual care as people stop having access to it in their local community.
Yeah. And, linking this back to consumer experience and something that we've seen at OODA, especially in the ambulatory surgery center segment of the market, there are a lot of benefits to safely providing procedures in that setting, both from a quality and cost standpoint. So, the shift is actually probably overall for the system a positive thing as we advance and enhance our ability to safely provide care in less acute settings. But I think one thing that remains is, I'm a broken record, but is that administrative fragmentation, especially, somewhat unique to these ASCs, is they're frequently joint ventures. There's frequently some level of physician ownership of the surgery center. You have often one entity that is running the facility side of the ASC, and then, mirroring the hospital setup. And then you have professionals, clinicians, physicians who are providing the actual professional services, so the surgeries or whatever they have. And then from an administrative perspective, it's a totally fragmented setup where the physicians are doing their own thing. Maybe they're engaging the patient ahead of surgery through their own platform, giving the clinical checklist. Then the facility side is doing the same thing, sending out a different checklist, maybe trying to collect a deposit or prepayment. And even though from a patient feels like they are trying to get one procedure at one place, and maybe their health plan is also requesting a prior authorization and they have to submit some kind of documentation, they have one elective event that's coming up, and yet they have 3+ entities that are reaching out to them, telling them what to do clinically, asking them for money, trying to verify benefits. There's this disconnect between this, arguably positive trend to less acute settings, meeting patients where they are. And then that is totally at odds with the administrative reality of these providers on the back end.
And unfortunately, as you start to see this shift, it's not just fragmentation within a single encounter, it's fragmentation of who's providing them. All of a sudden, you don't have a single administrative entity that, for example, is doing your surgery and your PT and your follow-up. You might have 3 different groups doing that. You might be getting your PT virtually now through an online service. You're also receiving telehealth services through your employer. You're getting, encounters with your PCP, but you also have a behavioral health support app. Now, instead of those being unified, instead of that record being unified, that care still has to be provided. People still need it. It's just a question of where they're getting it from, and are those sources talking to each other?
Yeah. Let's talk about virtual care, because this is not news, but I think that it is still worth speaking.
Yeah. So a lot of people ask me, is this going to stay? Is this the high water mark for telehealth and everything is just going to go back to normal? Certainly the high volumes that we saw, for example, in May and June of last year are not going to sustain, but I think it's pretty reasonable to expect that 25 to 30% of office encounters are all going to be virtual going forward. And, you know, that's a huge shift in how care is conducted.
Mhm.
We still see shortages in staffing, in availability of providers of all different scopes and all different tiers of license. That work has to be done somehow, and tools need to be brought online. People need to start looking at what they can do to free up and best deploy the time of the staff that they have, without impacting the care and the experience of their patients. That's where tools like automated billing and unified billing really come in. Historically, you may have had an entire floor of staff dedicated to assisting patients with this. If you don't have those anymore, your patients still need that help, and they need something that is going to assist them, something that's going to support them through that process. It doesn't have to be done in person. You can find tools that will assist you in that, but you have to, you know, spend the time to research them and deploy them. The other thing that we're seeing is this acceleration of virtual care beyond telehealth. The tools that really go outside of remote appointments to really create almost a new model of care. And those are getting deployed and used at rates that we've never seen before. And those are the ones that are most exciting to me. Those are the ones I think that really have the opportunity to not just transform care, but really give us that unified system that we're talking about.
Great. So I'm mindful of time, so I'll keep us moving along. And I believe we have our poll question, which
Yes.
Chris is going to administer.
Thank you to both of you. I've loved listening to you. And yes, we're running tight on time. So let me make this a quick poll here. We do want your feedback. Please, if you're listening, pay attention to the Zoom control. There's a panel in front of you now. With the first question, we'll do these quickly. Question 1, how satisfied are you with the patient experience your organization currently delivers? This is a question for providers and those out delivering care. Second question, in the next 12 months, how much care do you expect to be provided virtually? We've got our options there. We'll give you a couple seconds to answer these two questions. We'll close and then we'll share. Again, question 1, how satisfied are you with the patient experience your organization currently delivers? We're getting close to a point in which we can share that one. Second question, in the next 12 months, how much care do you expect to be provided virtually? I'll also remind you that we're answering those questions live as you submit them, so please keep them coming. And we'll also have a few minutes at the end here to be able to address questions directly. All right, great. Let me go ahead and end this poll, and I'm going to share the results. And would love your feedback, Alex and Midori, if you see those results there.
Yeah, I think this makes a lot of sense to me. You know, the ideal for experience is for people to enjoy it. It's for people to like it. And you see there in the poll, nobody's very satisfied. Almost everybody is somewhere in the middle. They don't have any strong feelings about it. That's better than hating it, but it's not good enough.
Thank you, Alex. And then we see a nice bell curve there with expected virtual care, with the most amount of people saying 41% saying 11 to 20% of their future care will be virtual.
Yeah.
Yeah, and I think when you see 70% of people saying 11 to 30%, that sounds about right to me. We were seeing totals in the middle of the pandemic up to 60 to 80%. That was clearly unsustainable. It was great that providers were able to scale up to that, to offer that as conveniently as they could. I think 20 to 30%, is 20 to 30% is what I'm predicting. But in that range, definitely, I think people have a good handle on what's coming up.
Thank you, Alex. Thanks, Midori. Back to you on the content.
Thank you. All right, so this is there are a lot of different pieces of this slide, but Alex,
Yeah.
you walk us through the different components, and then I'll have some questions around examples and
Sure. When I talk about going beyond telehealth, the left side of the screen here is really what I'm talking about. Telehealth is a good component of it. It offers a lot of opportunity. But when you're looking at tools that really offer uh, efficiency improvements for providers, give them time back, really help relieve some of their tasks and make their life a little bit easier, offer better care for patients and a better view of what patients are going through. These are the tools that really help. Patient engagement, asynchronous telehealth, home monitoring, absolutely vital technology that's going to play a major role in healthcare going forward. Unfortunately, what we see is that by themselves, these are great tools, but they aren't sufficient. There are so many circumstances in healthcare where in-person care is essential. You can't get rid of it. You need the provider and the patient, first of all, to build that trust relationship, to build that relationship where the patient understands what's happening, is invested, knows what's going on with them and their diagnosis and what they need to do. And that trust relationship, as we saw, is really vital to driving the best results from these virtual care tools. But we also have to acknowledge the reality that patients are getting care from a huge number of different sources now. It's not just your PCP and the tools that they give you. It involves pharmacies, retail clinics, healthcare from your employer, healthcare from your payer. You might need community resources, help with nutrition, with transportation, with childcare. These are all fundamental components of good healthcare, and they need to be tied together. And again, this is where that fragmentation comes in. The more that these are broken apart, and the less that providers at each of these different areas have a view of what the other people are doing, the more disruptive messaging the patient is getting, different messages from different providers, whether it's bills, whether it's requests for information, for data sharing, for appointments, all of that inhibits the consumer experience, makes the patient less interested in engaging in care, makes it harder for them to know who knows what and when, where they're supposed to go and what they're supposed to be doing. And like we said, patients are paying more and more of this. They're shouldering more and more of this burden. And it really is essential that they trust that when they're paying out that money, their provider has the best information possible, knows what else they've been doing, and is integrating that into their care recommendations. That's going beyond just remote appointments, beyond just virtual care, into broad distributed management, building that network, bringing it together into a single integrated experience for the patient.
Yeah, and I know, you and I talked about this a little bit over the last week. I don't think you're suggesting that we need one patient portal to rule them all, or to have a kind of like benevolent dictator of healthcare that brings everything under one umbrella. Although that type of centralization would solve certain problems, although create others.
Yeah.
I'm wondering if you can speak to some examples of what this looks like in the wild. I know we have one from the consumer world coming up, but anything within the healthcare world that you can think of, what does this look like, either in full or in part, that you can share with us?
Yeah, I mean, when it comes down to it, a lot of the time, these are areas where expertise is different, where what the patient needs is different. If you tried to do it all under one organization, under one umbrella, like you said, one portal to rule them all, that doesn't offer that breadth of expertise that really is being deployed here. Organizations that are doing this really well aren't necessarily doing all of it themselves. What they're doing is integrating the data. They are understanding where else they've got agreements or data feeds from all of the various areas, apps, platforms that their patients are using. They don't necessarily have to be involved in each one of them, but they need to know what's going on. Historically, we've seen these be at best competitive and at worst almost antagonistic relationships, like you were outlining, between payers and providers. That reality needs to change, and in the best cases, it is changing. We're seeing payers and providers be willing to, whether it's a formal partnership, whether it's just data sharing and making sure that there's as much interchange as possible, really support each other and support their patients, most importantly. When you do that, and when you have services from the payer coming from the payer, services from the provider coming from the provider, services in the community being done in the community, but those different stakeholders communicating with each other, exchanging data, sharing data, supporting, for example, a single comprehensive patient record as opposed to a bunch of fragmented patient records owned by each individual organization, that enables a much more comprehensive care experience for the patient and a much more satisfying consumer experience. It allows them to feel like the people they're going to are professionals, know what they're doing, are coordinated, and prevents cross-information, mutually contradictory information, redundant information from really breaking that relationship down.
Yeah. Let's quickly go through an aspirational experience for here,
Yeah.
and, point out some of what you were just describing and how that's applied in a consumer tech context.
Yeah, I mean, this is no longer theoretical. We've been asking for, a long time, is Amazon going to change healthcare? And what they've finally decided is they're going to do their best. Amazon is an organization that has really placed their hat in a couple of areas that address what we're talking about. They offer a lot of different services, a lot of different things. You can have an Amazon television, Amazon books, Amazon music, Amazon groceries. All of those experiences, all of those different services happen with a single UX in a single application. They're all done the same way. They're easy to use. You can get them on different devices and it all looks pretty similar, and it's all shared. There's none of this fragmentation. There's none of this lack of knowledge where one hand doesn't talk to the other. They've invested a huge amount in their customer service, in their ability to reach out to reach out to customers and have customers reach back to them, to do it proactively, but also to allow customers to, reach out when there's a problem and have it resolved quickly and accurately. And the thing that really supports all of this, and this is where their biggest competitive advantage comes from, is the amount that they've invested in the data back end, in collecting data, analyzing it, and deploying that, not just seeing what happened, but what is this person probably interested in? What is this person likely to be wanting to buy next? What are they likely to want to do? What are they probably doing? From a privacy perspective, it's a little terrifying, but they're fantastic at it. You can't deny that. Those are things that healthcare is still struggling to do. And unfortunately, if you're not ready for it, Amazon is coming to do it for you. They have a number of different options, a number of different ways that they could have addressed it. Amazon Care is what they picked. It's a primarily telehealth, but not exclusively telehealth option. Historically, they've done it in Seattle and Washington State with a captive practice, giving access to both telehealth and in-person care, prescriptions through PillPack, navigation through Health Navigator. And they're now offering this more broadly to their employees, eventually to other employers, and almost inevitably to consumers across the United States.
Mhm. So mindful of time, I want to spend one minute before we get to our poll and wrap up. So what's a health provider to do? What if we're so far away from the Amazon experience? What does moving toward our vision look like in the near term? How do we get there?
Well, the first thing is to recognize how vital that consumer experience is, not just at the front and back end of an appointment, but all throughout what you're doing and what your patients are doing. The further along you get in that journey, the better. It requires acknowledging that you may need to think about some things as an organization, make some priorities, identify what needs to be done now, what maybe can be done in a little bit. Look at what your solutions are. How well do they work together? How similar are they? Is it just that they've got the same branding, or can people access them conveniently, easily, in similar ways? Those are the really essential things that organizations need to do now. Within the next 5 years, we're going to see this move from simply having some tools that make life easier to having platforms where people are accessing care, accessing communication, getting education and advice, where so much of this is automated and distributed directly to patients within that unified system. If you have a healthcare system or a practice or a department that isn't willing to acknowledge that change, you're going to have a really hard time.
Yeah. So let's go to our last poll, and then we'll do our wrap up. So on a scale of 1 to 5, I'll just go quickly, Chris. How concerned are you about these outsider consumer tech companies entering healthcare?
We'll give people about 5 seconds. We're going to wrap this one quickly, as we do have one last slide to summarize the material today. We're about there. Thanks for answering the poll. We'll go ahead and end and share that. Here are the results. Looks like very concerned. 46% said very, 31 said just under very concerned.
If I could have answered it, that's where I would have fallen to.
So we had a great discussion about a lot of different topics and trends that predate COVID and that have been accelerated by COVID. I'll give my spin on our takeaways. Alex, would love your thoughts too. I know we're running up against time, but I think that, as you mentioned, step one is to acknowledge that consumer experience is not a nice to have, it's a need to have from a financial standpoint and clinical quality standpoint. And that is true across a fee-for-service, value-based care, or blended environment. And second, the consumer digital revolution has been on its way for a long time across every other part of our lives. And providers can help get with the times by investing in that experience, recognizing and then making the changes within your organization to meet that need, especially in a distributed care world.
Yeah, I think those sum it up really well. We got one question coming in, which I think is really worth addressing. Companies providing the best consumer experience seem to be integrated platform companies. Should healthcare providers look for solutions from platform companies where the solution is extensible? It's certainly an option. There are more and more of them. I don't think it's necessary. What you need to do is you need to look at the solutions you have, figure out how they work, what they're doing for your patients, what they're doing for your workflow, for your providers and your staff, and make sure that they can work together smoothly. They don't all have to be from the same provider. They don't all have to be in a single platform, but they do have to play nicely.